Good morning. Myself Dr. Chandrasekhar Bangarwar, Professor Department of Kriya Sharir, SRM State Ayurvedic College Bareilly, Uttar Pradesh. Dear students, as per your syllabus, today we will talk about resistance and immunity. Both of the things are very much important as per current scenario. The syllabus for BMS first year student expected is immunity, classification of immunity, innate, acquired and artificial immunity, different mechanisms involved in immunity, humoral, that is B cell mediated and T cell mediated immunity, hypersensitivity. Let us start. In healthy person, homeostasis is maintained through the continual combat against harmful agents which are present in internal or external environment. Homeostasis get disturbed by stressors like pathogens. You are aware about the homeostasis by means when body's internal environment is normal condition. This internal environment is nothing but a extracellular fluid present inside the body. When all contents of the extracellular fluid, gaseous, nutritional factors, hormones, all the contents are normal. When the volume of this external fluid is normal and when temperature of the external fluid is normal, it is said that we are in homeostasis. This homeostasis again and again gets disturbed by the stressors like pathogens. What are the pathogens? Pathogens are disease producing microbes such as bacteria and viruses. For example, 2019 novel coronavirus. Now, what is resistance? Resistance is the ability of the body to ward off the disease through body's defense mechanism. In Ayurveda, it is called as Vyadhikshamatva. There are two types of resistance. One is non-specific resistance or innate defense. Second one is specific resistance, also known as immunity. So, resistance or immunity, both are not the same words. Many times they are applied for each other by same meaning. Immunity means specifically specific resistance of the body, and innate defense means non-specific resistance of the body. This non-specific resistance consists of first line of defense and second line of defense. This non-specific resistance, first line of defense includes 9 physical and 4 chemical factors, and second line of defense. Although several mechanisms contribute to innate defense, also called non-specific resistance to disease, they all have two things in common. They are present at birth and they offer immediate protection against a wide variety of the pathogens and foreign substances. Non-specific resistance, as its name suggests, lacks of specific responses to specific invaders. Instead, its protective mechanism function the same way against any invader. That means whatever bacteria is there, whichever virus is there, whichever toxin is there, it is not important. It is a common effort, common mechanism of the body to defend itself is known as innate defense or non-specific resistance. This non-specific resistance mechanism includes the external physical and chemical barriers provided by skin and mucous membrane. They also include various internal non-specific defenses such as antimicrobial proteins, natural killer cells, phagocytes, inflammation, and fever. The skin and mucous membrane of the body are first line of defense against pathogens. These structures provide both physical and chemical barriers that discourage pathogens and foreign substances from penetrating the body and causing the disease. First line of defense includes physical factors like skin and mucous membrane, in which epidermis of the skin, mucous membrane, mucus, hairs, cilia, lacrimal apparatus, saliva, urine, defecation and vomiting. These factors are there. Chemical factors include sebum, lysozyme, gastric juice, vaginal secretions are there. Second line of defense or internal defense includes antimicrobial proteins like interferon, complement system, transferrin, and natural killer cells, phagocytes, inflammation, and fever are included. First is epidermis of the skin, physical factor. Epidermis is outer layer of the skin, forms a physical barrier to entrance of the microbes. Periodic shedding of the epidermis help remove microbes at skin surface. Bacteria rarely penetrate intact surface of the skin. If the surface is broken due to the cuts, burns, and then pathogens can enter. Second is mucous membrane. Mucous membrane, which is present in the body cavities, secrete a fluid called mucus, which lubricate and moisten cavity surface. As mucus is viscous, it traps many microbes and foreign substances and inhibit the entrance of many microbes. Mucus traps microbes in the respiratory and gastrointestinal tract. Hair present in the nasal cavity filter out microbes, dust, and pollutants in the nose. Mucous membrane of the upper respiratory tract has cilia. Cilia together with mucus trap and remove microbes and dust from the upper respiratory tract. Lacrimal apparatus. Lacrimal apparatus is present in eyes, secrete tears which dilute and wash away irritating substances and microbes. Tears also contain lysozyme, an enzyme capable of breaking down the cell wall of some bacteria. Saliva. Saliva is the secretion of salivary gland in mouth cavity. This saliva washes microbes from the surface of the teeth and mucous membrane of the mouth. Urine. Urine washes microbes from the urethra and do the cleaning of the urethra and stop colonization of microbes in urinary system. Defecation and vomiting. Defecation is the process by which stools are eliminated from the body, and vomiting is the process by which the contents of the stomach are eliminated from the body. These both of the procedure, that is defecation and vomiting, also explain microbes. Now there are some chemical factors in first line of defense which prevent the bacterial pathogens to enter inside the body. They are sebum, lysozyme, gastric juice, and vaginal secretion. Sebaceous glands of the skin secrete an oily secretion called sebum that forms a protective film over the surface of the skin. The unsaturated fatty acid in sebum inhibit the growth of certain pathogens, bacteria, and fungi. Perspiration also flushes microbes from the surface of the skin. Lysozyme also have a bactericidal effect. This lysozyme is a type of protein which is present in the many of the fluids inside the body. Gastric juice is secreted in stomach by gastric glands. It is mixture of hydrochloric acid, enzymes and mucus. The strong acidity of the gastric juice when pH is in between 1.2 to 3 destroys many bacteria and their toxins. Vaginal secretions moves microbes out of the body in females as they are acidic in nature and discourage bacterial growth. This is about the first line of defense. Now second line of defense in innate defense includes antimicrobial proteins, natural killer cells, phagocytosis, inflammation and fever. Antimicrobial proteins, blood and interstitial fluid contains three main types of the antimicrobial proteins that discourage microbial growth. Number 1 is interferon, number 2 is complement system and number 3 is transferrin. Interferons, lymphocytes, macrophages and fibroblasts infected with virus produces protein called interferon. Interferon diffuses into neighboring cells of the infected cells and stop reapplication of the viruses. Interferon cannot stop growth in infected cell, but disease is spread only when the virus infect and spread in the neighboring cells. This interferon prevents neighboring cells for its infection. Three types of interferons are present in the body: alpha interferon, beta interferon and gamma interferon. Second is complement system, a group of normally inactive proteins in the blood plasma and on blood plasma membrane makes up complement system. Complement system causes cytolysis of the microbes, promote phagocytosis and contribute inflammation. Cytolysis is burst of the cell. Then transferrin, we have seen during the hemoglobin, when this hemoglobin is destructed, heme and globin to different forms, it is separated. Heme is basically iron, but heme consists of iron portion and non-iron portion. Iron portion of heme is concerned with transferrin. Iron binding protein called transferrin inhibit the growth of certain bacteria by reducing amount of available iron. Natural killer cells. 5 to 10% of the lymphocytes are natural killer cells. Natural killer cells are also present in the spleen, lymph nodes and red bone marrow. Natural killer cells have ability to kill a wide variety of the infected body cells and tumor cells. Natural killer cells attack any body cells that display unusual and abnormal plasma membrane protein. Natural killer cells bind to the infected cells and release granules contains protein called perforin, which burns infected cell by process cytolysis. Natural killer cells also release protein called granzyme, which induce infected cell for apoptosis of self-destruction. Now phagocytosis, phagocytes. Phagocytes are the specialized cells that perform phagocytosis, that is ingestion of the microbes. Two major types of the phagocytes are neutrophils and macrophages. When an infection occurs, neutrophils and macrophages migrate to the infected area. During migration, monocytes enlarge and develop into actively phagocytic macrophages, both wandering and fixed type of macrophages. This phagocytosis occurs in 5 stages. Number 1, chemotaxis. Number 2, adherence. Number 3, ingestion. Number 4, digestion. And number 5, killing. First step is chemotaxis. Chemotaxis is chemically stimulated movement of phagocyte to site of damage. Chemicals may come from the invading microbes, WBCs, damaged tissue cells or complement proteins. Attachment of phagocyte to the microbe is called adherence, which is the second step. The binding of complement protein to the invading pathogen is adherence. The third step is ingestion. After adherence, the plasma membrane of the phagocyte extend projections called pseudopores that engulf the microbes in the process called ingestion. The fourth stage is digestion. The phagosomes enters cytoplasm and merges with the lysosome to form single large structure called phagolysosomes. The lysosome contribute lysozyme, which breaks down microbial cell wall and other digestive enzymes that degrade carbohydrate, proteins and lipids. Fifth and last stage of the phagocytosis is killing. The chemical onslaught provided by lysozyme, digestive enzymes and oxidants within the phagolysosome quickly kills many types of the microbes. Any material that cannot be degraded and remains there is called residual bodies. This is about the phagocytosis. The main function of the WBC is phagocytosis. Now inflammation is body's defensive mechanism. Inflammation is a non-specific defensive response of the body to tissue damage. Pathogens, abrasion, chemical irritations, disturbances of the cell can create inflammation. There are 4 signs of the inflammation: redness, pain, heat and swelling. Sometimes loss of function is there, depends on the site and the depth of the injury. So the inflammation is so common symptoms observed in a patient. Now inflammation is an attempt of disposal of microbes, toxins or foreign material at the site of injury to prevent their spread to other tissues and to prepare the site for tissue repair in an attempt to restore tissue homeostasis. During inflammation, inflammatory responses has 3 basic stages. First stage, vasodilatation and increased permeability of the blood vessels. Second is emigration of the phagocytes from blood into the interstitial fluid. And third is tissue repair. The following factors participate in the inflammation: histamine, kinin, prostaglandin, leukotrienes and complement. Fever. Fever is also a protective mechanism of the body against infection. Fever is an elevated body temperature caused by resetting of the hypothalamic thermostat. You are aware of the hypothalamus, which has a thermostat. We set our body temperature at a specific Fahrenheit level. Now the most common cause of fever are viral or bacterial infection and bacterial toxins. Other causes are ovulation, excessive secretion of thyroid hormone, tumors and reaction to the vaccines. That means because of these factors your body temperature increases, which is the body temperature is actually 98.6 plus or minus 1 degree Fahrenheit. When your body temperature increases more than this level, that condition is called as fever. What happens during fever? When phagocyte ingests certain bacteria they are stimulated to secrete a pyrogen. Pyrogen means fever producing substance. One pyrogen is interleukin 1, which circulates to the hypothalamus and induce neuron of the preoptic area to secrete prostaglandin. Some prostaglandins can reset hypothalamic thermostat to high temperature, and temperature regulating reflexes work according to this new higher thermostat. When thermostat is set at 103 degree Fahrenheit, heat promoting mechanisms like vasoconstriction, increased metabolism, and shivering operates at full force. When pyrogen disappears, thermostat again reset at normal temperature, and heat losing mechanism like vasodilatation and sweating work accordingly. Higher temperature intensifies effect of the interferon and phagocytic activities of the macrophages while hindering reapplication of some pathogens. Because fever increases heart rate, infection fighting WBCs and delivered at the site of rapidly. Antibody production and T cell proliferation increases. Heat also spread up the rate of chemical reactions which may help body's cell repair themselves more quickly. This is about the fever, a defensive mechanism. So you should remember that what is resistance, two types of the resistance, non-specific and specific. In non-specific resistance, there is first line defense and second line defense. First line defense consists of the 9 physical factors and 4 chemical factors. Second line of defense consists of the 5 factors. So, this is about the innate defense, which is also known as the non-specific resistance. Another part is immunity or a specific resistance that will be discussed and later. Thank you.